Welcome everyone. In the next few moments I would like to introduce myself and my PhD topics, which are titled Childhood Cancer Survivors, Reintegration to Society and Improving Neuroblastoma Treatment. My name is Márk Hernádfői. I'm a first-year PhD student at the Center for Translational Medicine, and I'm starting my residency in pediatrics at Bethesda Pediatric Hospital. My vision is to improve pediatric oncological care, starting from the point of diagnosis through the period of treatment until the long-term follow-up, taking into special consideration the ultimate success of therapy, which in this case is the complete reintegration to society. And to do that, our work group's mission is to define the long-term socioeconomic effects of diagnosis and therapy in survivors of childhood cancer, and regarding my other topic, is to find the best available therapy in the treatment of neuroblastoma. The first step in both projects is to conduct a meta and a network meta-analysis. Now I would like to talk a bit more in detail about my first project, which is titled Comparing Social and Economical Outcomes Between Former Childhood Cancer Patients and the General Population. So now we are at the stage in medicine where we can cure 8 out of 10 pediatric oncology patients, which means that they are diagnosed, successfully complete therapy, and the follow-up, and after that they can be led back into society to lead a complete and happy life. However, recent studies show that this is quite often, unfortunately, not the case, because these childhood cancer survivors are more likely to complete only compulsory education. They often have special education needs, and they have significantly higher chances to be unemployed. They have difficulties in maintaining a job, and they usually earn less money compared to their peers. Other studies show that the survivors are less likely to become married and to have children on their own. I think that we can agree that these are very important contributing factors of what we call a complete and happy life. So our aim is to investigate the differences in social outcomes with major focus on education, employment, marital status and family between former childhood cancer patients and the general population. So our question is that, do former childhood cancer patients have difficulties in reintegration to society compared to their age and social status matched groups who didn't have oncological disease? Therefore, we are investigating the general population. Our exposed group are those children who survived the cancer experience. We compare them to their matched groups, and we would like to assess the achievement of their social potentials. Our hypothesis is that former childhood cancer patients have elevated risk of poor social outcomes compared to the general population. After we are done with this study, you might ask that, what's next? Well, with this project, we have 3 main goals. First of all, we would like to draw attention to this program and to help clinicians to include the knowledge about the long-term consequences into their everyday decision-making. Secondly, we would like to identify those patients who have increased risk of poor social outcomes and to determine the aspects of life that are affected the most by the disease and the treatments. Last but not least, with our acquired knowledge, we would like to find solutions which can help to improve the complete reintegration of these former patients. We conducted a systematic search with a rather long search key with 4 main domains titled Pediatric Oncology Survivors and Social Outcomes. We had around 30,000 hits, and after the duplicate removals and the title and abstract selection, well, based on how many minor outcomes we will include in the final work, there we have around 300 or 500 articles that are eligible for full text selection. So now, continuing with my second project, which is titled Comparing the Effectiveness of Different Therapeutical Approaches in the Treatment of Neuroblastoma. Neuroblastoma is the most common cancer in infants and the most common extracranial solid tumor in children. As you can see, the survival and the success of therapy greatly depends on the risk group stratification, and I would like to emphasize that the high-risk group, which is almost half of the cases, have a really poor 5-year survival rate, around 50%. So why do we want to conduct a network meta-analysis? Is because in recent years there were many new therapeutical approaches and clinical trials trying to improve the therapy's success, such as the targeted molecule dinutuximab or the radioiodine-based MIBG therapy. But we still do not know which one is the most effective. Therefore, we would like to identify the most effective treatment modality in neuroblastoma therapy via the available data. Our question is that is there a difference between the effectiveness of different therapies that we use in the treatment of neuroblastoma? And therefore, we are investigating neuroblastoma patients, and we compare all applied and available therapies. And we would like to assess the response evaluation criteria, which is the state of the disease and the patient and the quality-adjusted life years, with secondary outcomes such as quality of life and frequency and severity of adverse events. Our hypothesis is that there is a therapy among the available ones in the treatment of neuroblastoma that is superior in effectiveness compared to the others. If we complete this study with our data, we can make suggestions to modify the already existing protocols to improve the therapy. So, to conclude my presentation, I think we are at the beginning of two very exciting journeys. One concerning the final and ultimate success of pediatric oncology and hematology, and the other one is trying to improve the therapeutical success in one of the most common cancers in childhood. And I would like to finish with a quote from Richard Feynman, which states that our responsibility is to do what we can, learn what we can, improve the solutions, and pass them on. Thank you for your kind attention, and I'm looking forward to your comments and questions.
What is your propose for the solution to reintegrate these patients?
Well, it will depend on actually the state of the patient, because if they are before or during therapy, we can take into consideration the different modalities and how they will affect their life in 20 or 30 years. After they completed therapy, or if we have no therapeutical choices because we have the gold standard and we use that, then we can complement, I think, the therapy with psychological or work-related support to these patients.
Are there any guidelines regarding how to treat or what kind of public health policies to use in this group of patients? And actually, I think there are huge differences between countries because, yes, of course, there will be a huge difference in less developed countries than in the Western countries. But are there any kind of guidelines regarding this? And what do you think? Would you like to include these recommendations somehow in your discussion or in your paper about this part?
Thank you for your question. Well, as I was going through the titles and abstract, I found that what you have said, that they're mostly local projects are going on and studies regarding them. Therefore, there's no one uniform or generalized protocol to assess these questions. And yes, we plan to include that during the selection. We made a special folder for these kind of articles.
My question relates to your first study, which is a very interesting study in terms of you looking at long-term outcomes for kids that survive cancer. And it is obvious to all of us that they probably do much worse than healthy ones. But then, what is your view? How much of this detrimental effect of the cancer is related to the effect on the child and on the family? Because what we see normally that, if there's a cancer in a child, in a family, that often affects the whole family in a very, very bad way. So families can fall apart, and basically their ability to function well in their adult life stems partly from the cancer, and probably to a large part it's attributed to the defect in the family what was brought in by the cancer. So what is your view how much is related to the individual distress and how much is related to the more wider concept of damage to the family and the microenvironment of the child.
Thank you. So, yeah, actually, this is one of our planned minor outcomes to gather data about, because there are articles about family functioning and the incidence of divorce, for example, during the patient, during or after the child is diagnosed with cancer. And I think it can affect the family. However, I was most curious about the divorce, because that seems like a hard outcome. And what I found in the literature, that the incidence of divorce does not elevated by the cancer of a child.
That's it. That's a very interesting result.
Yes.
But maybe these families need some kind of skills and ways to deal with this stress. And so I would have thought that, you know, this meta-analysis, what you are proposing now, hopefully leads to formalizing some interventions for these kids in addition to existing medical care. And then my thought would be, why don't we focus on the families as a whole, not just the kids' needs?
We are planning to also the siblings and the parents.
How can influence socio-economical status, cultural status of the country, the later quality of life? Would you like to analyze the differences in the world between the different continents, because different traditions? But how do you plan to analyze as this? I think it should be some difference even for the cured patients in regarding the quality of life in India and in the US, or in the different regions of the world.
Well, in our study, we are not including that where they come from. I mean, their social economic status that they already have. But I know from the literature and came across different articles that not even third world or undeveloped countries, but also, for example, inside the US, there are many studies that compare, for example, the average income of the area and the distance of the family from the hospital. That can already affect the success of outcome and the patients. The parents' education and income.
I really suggest to take it in the analysis, the different regions of the world. So how can influence the late effect?
Yeah, maybe for this one it would be too big to hold all together, but I think this is a great topic for our next question.